My daughter who passed away, she was 18 and her name is Ritheika Omtra.
She was in perfect, a normal child, you know, absolutely no health condition that I don't think we even went to a doctor in the last 2 years. I did consult 2 or 3 doctors for my parents, probably like 2 or 3 months before we took ours, because my parents have some health conditions. So we asked 2 or 3 doctors and all of them said the same thing. Vaccines are totally safe, no side effects. They don't even have to worry about the current medication they were taking. And because Ritu was just a normal child, it didn't even occur to me that I have to go to a pediatrician and ask if there's any potential side effects or risks. And even at the vaccination centers, there was no information put up, nothing of any sort. It was just by word of mouth that I hear from others that you might expect high fever the next day or body pains, but that should subside within 2 days. That was the only information we had. We both, Ritu and I, got our vaccines on the 29th of May around 9:30 a.m. and we both got Covishield. And we came back home and around 11:30 or 12, around noon is when she said her head was starting to hurt. I thought it was probably because, you know, we haven't been out much because of the lockdown. So probably it was just the drive during the day, broad daylight. So I thought it must be just a moderate headache from that. But after lunch, she started complaining that her body was hurting, her headache was getting worse, and starting at around 4, both of us started having a fever. The next day morning when she woke up, the pain didn't get better. But there was some pain in her arms and legs now, not the entire arms, just the hands and the legs. And the itching and the burning was so severe, she would constantly hold an ice pack in her hand. I would just give her ice in a Ziploc bag and she would hold it in her hand. So, and she wanted me to rub her palms all the time. And when I touched her palms, they were really hot and red. The 7th of June, the next morning, which was Monday, and I thought it's been 2 days. I've been giving her Avil, I've been giving her Crocin, and her symptoms are not getting better. So I took her to get her blood test done. We did that in the morning, and again, she was saying my head is kind of a little bit sore, and she started noticing pink spots underneath her palm, underneath the skin. It was not very prominent, but I could tell it was different from my palm. Her palm looked pink with blotches of pink spots. So we went, and that afternoon, because she was not getting enough sleep during the night, in between she would take cat naps. She would just sit on the sofa and fall asleep. And then she didn't eat lunch because she was not feeling well. Around 4 o'clock, I got a call from the diagnostic center. And they said this, sorry, I didn't pick up the call. It was a random number, so I didn't pick it up. So they called me again around 9 in the night. And they said, we are calling from Vijaya Diagnostics. Why are you running a blood test on this patient? I said, I'm her mom, and I just wanted to check if there's an allergic reaction. The doctor said if there's some reaction, you could know in the blood test. They said, the reason we are calling you is her platelets are extremely low. The pain just started shooting up. Usually her headaches, even if she gets them once in a while, they are not this severe. She doesn't take medication for her headaches. They are very minimal. But this time her pain was such a shooting pain. She was like, Mommy, my head is hurting. So I started walking with her in the balcony just to distract her away. And she says, I'm feeling nauseous. And I know how bad those vomitings could be. So I started trying to divert her attention, but she started throwing up. It didn't stop. And she started, I gave her Crocin, she threw up. I gave her a sip of water, she threw up. I gave her just a sip of coconut water, she threw up. And she kept throwing up every 20 to 30 minutes, and she kept track. She said, Mama, I threw up for 6 times. And it was around 10:30 in the night. I tried to call the doctor that I spoke to in the morning. He was not available. He didn't give me his personal number. I asked him, can I have your personal number? He said, I can't give it because there's so many patients who try to reach me. So I tried to message him. He didn't reply back. So I called my uncle, Dr. Uncle, the surgeon, and he looked at her in the video chat. And he started questioning her, Ritu, how much is this? How much is this? And she was answering. And then he said her lips look dehydrated. And I told him that I see a purple patch on her eyelid. And he said, okay, now that means you need to go to the ER. Maybe she needs some IV fluids. So we rushed her to Apollo. And we went to Apollo. First thing they asked is, what is the problem? We told them that she has headache and she's throwing up. And they said, oh, then it's a COVID case. I said, how can you declare it as a COVID case without even testing her? Then we had to put her in the waiting room until they could do the blood work and all. And we said, we are not going to put her in the COVID ward until her COVID results come positive. So there was this small pavilion, they had beds, so they started putting her there and they started giving her fluids and pain medication. But in spite of giving her the pain medication, the headache didn't go down. So they somehow got hold of the doctor whom I spoke to earlier in the morning, and he immediately referred her to the neurologist. And the neurologist said to get her an MRI. This was around 2:30 in the morning. And we tried to get the MRI and the sound bothered her so much and she was signaling me, please stop, stop. And she said, Mama, this is a torture, I cannot bear it. So poor thing, she couldn't cooperate because she already has a headache and the sound was even more horrible. But the technician told us right away, there's a problem in her brain, get her admitted. I didn't believe him, to be honest. How can a healthy child have a problem in the brain? There was absolutely no symptoms ever. And we were back in the pavilion waiting for the doctor to come up. And the doctor came, it was around 6:30 maybe. He said, we got all the blood reports. She doesn't have COVID. COVID test is negative. But her platelets went down to 30,000. And the MRI, we couldn't complete it. But with the report we have, she seems to have a clot in her brain. So we need to immediately start investigating. So we got her admitted. And once we got her admitted, within few hours, probably like
within an hour
or so, she got seizures right in front of our eyes. She got seizures and the doctors took her away. She was surrounded by like 10 or 12 doctors trying to revive her. She was put on the ventilator. And meanwhile, my uncle comes in and he starts talking to other doctors. I don't know when they did a CT scan in between, but they showed him that she has a clot and she has hemorrhage and the pressure is so much that her brain is damaged enough. So they need to do an emergency surgery right away. 24 hours or 18 hours before or 12 hours before, she was perfectly fine at home. And then they said, we need to do a surgery. So she went in for a surgery. Is it craniectomy? Is what they did, where they basically open up a part of the bone of the skull and keep it aside so the pressure of the brain can be released. She had so much pressure building up from the hemorrhage that it was damaging the other parts of the brain. And that's it. Doctor didn't say anything that day. The next morning, this all happened on the 9th of June. 10th of June, the doctors come in for rounds every morning at 9. So they called us for a meeting. And Mr. Alok Jain, who is the surgeon, told us, look, the condition she has is called CVST, Cerebral Venous Sinus Thrombosis.
And also at that time, they said the root cause is ITP, idiopathic thrombosis something.
No, actually, he said, we don't know yet. It could be idiopathic thrombosis. And he said two things. First thing is, there's a 50-50% chance of her survival. I really am concerned about her survival. And even if she survives, the quality of life she has, because we're looking at her CT scans and her brain has been extensively damaged. In between, I heard from the doctors. Until then, I didn't know. This could be a vaccine-induced thrombotic thrombocytopenia. After 5 days or 6 days, on 15th of June, they said, we tried everything. There was some kind of a shock she got last night. Her pupil movement, whatever was there, has gone down. And there's no electrical signals or active brainstem activity in her brain. And at this point, we consider her brain dead. This is Tuesday, 15th of June. They declared her brain dead. And they gave us options, whatever you want to do with her. They gave us 3 options. You can take her home and just let her pass away. We will remove the life support. Or 2, just wait until she naturally, ceases, rest of the body ceases to function. Or 3, you can donate her organs. But I, as a mom, was not ready to give up. To be honest, I didn't trust them. I said, how can she be brain dead just in 6 days? And they said, we will still support you, whatever other therapies or options you want to try. Alternative medicines, we will completely support you. So at that point, we started Ayurveda immediately. And my husband started researching about stem cell therapy and gene therapy, where we would try to regenerate the brain cells. But nothing worked. Nothing worked.
Yeah, for the stem cell therapy, they needed blood circulation to the brain, which we had to test again. And
so they did an MRI with the angio, and the result was not in favor. They said there was absolutely no blood flow from the neck onwards to the brain.
So no medicine would work.
So no medicine would work. And they said, at this point, we supported you for the past 4 days, but her brain is at a point where it's degenerating and it's liquefying.
Started to liquefy and leak.
So what I was thinking was a blood at the spot of the stitches. They say it's not blood, it's actually the brain that's liquefying. And they said it's unethical on your part to keep her in this condition. I said, can't we take her home and continue to keep her on the ventilator? I was still hoping maybe she'll come back from brain dead. Maybe some miracle will happen. All the prayers going around the world for her will work. But they said, again, it's unethical. You need to understand her brain is liquefying and there's no way she's going to come back. And at that point, my husband literally begged me, saying, you know what? I don't think she'll come back, but let her live through others. Look at her urine. Her urine pouch was constantly filling up. She has excellent kidneys, and the doctor said her body is in perfect condition. An 18-year-old whose organs are all in perfect condition. Let her continue to live in others, though we cannot see her physically. So that was the toughest decision in my entire life, to just let her go. So we had to sign the paperwork, and then so we could continue with the process of Jeevan Dan. And the entire day I spent with her, still hoping maybe she'll get up with my touch, but it didn't happen. On the 20th of June, early hours at 1:30 a.m. is when they took her to the OT operation theater. And I still don't know how I could send her away.
And in between, somehow government got interfered in this case. And the professor from medical college from government was sent for autopsy. And they did autopsy. I don't know what triggered that, but that happened. And there was a delay in our discharge. And we don't know what happened in the autopsy. We are yet to get the report. We contacted hospital, and hospital contacted the health department who triggered the autopsy. Even they did not get the report yet. So we still don't know what was the findings in autopsy.
But I called the doctor, the counselor, day before yesterday, and I asked her if she heard back anything from, if they got back any report from the autopsy, and they said no. And it's been 2 weeks today since it happened, and they said we haven't received anything yet. And I asked, can you at least ask the doctors if they were able to conclude what the reason was? And they continue to say the same. Number one, it could be VITT, vaccine induced.
Presumptive, that's what they said. Presumptive VITT or COVID. And they said COVID could have been caused by vaccine also. That's another thing they said, which is very confusing. Towards the end, recently we found out about AEFI, and we were trying to make sure that is filed. And during those investigations, we found that government themselves has reported it to, like the health department or vaccination department themselves had reported it to government. I don't know exactly what that report means, whether it's AEFI or some other kind of report. Tomorrow we are going to go to that vaccination center and figure this out and try to make sure that AEFI is reported and we get that report and the national ID number. So some kind of reporting to government has been done. We have to ensure that it is proper AEFI.